Cystic fibrosis. I think you're about to learn something new. What is cystic fibrosis?
Mucus everywhere.
Why do they have mucus everywhere? She's like, beats the hell out of me, you know?
That's the problem. Lots of mucus on all their organs.
How did it get there? How did they get all this mucus? Okay, it's genetic. All right, cystic fibrosis is a genetic disorder. It is an autosomal recessive disorder. What? It is an autosomal recessive disorder that causes an abnormality of the sodium and chloride channels, which causes very thick, viscous mucus to build up in every organ of their body. That's why I drew the big ones. This is not just a lung disease, okay? This is an everywhere disease. So what is cystic fibrosis? An everywhere disease. That it's an autosomal recessive disorder, which means it's genetic, but what has to happen for you to get it? Both parents have to have the trait in order for you to have the actual disease, right? You understand what I'm saying? No, they have to be a carrier in order to pass it, okay? Because it's autosomal recessive. So with every single pregnancy, they have a 1 in 4 chance of the baby getting the disease if mom and dad are both carriers, right? Because 25% will not be affected at all. 25% would have the disease, and then 50% chance of being a carrier. What's the matter?
Oh, okay, I was just like, I hear this really weird, like, high-pitched sound.
I know, I was like, is it your computer?
I think it's something else.
This ice cream truck.
Yeah.
Oh, okay, that was convenient. As soon as you asked me to listen.
Wait, but you asked me, and she didn't even know what I was talking about.
I know, but y'all hear things all the time in here. You're like, oh my God, somebody's here, and I run back there because I think my kid's getting kidnapped.
Computer was dinging.
Computer, are you dinging? No, Colby, I'm not. Oh, I get it. Okay, no. All right, so this is an autosomal recessive disorder that causes an abnormality of the sodium chloride channels. Is it getting kind of hot in here? Yeah. Can you just turn it down real quick?
It was at 78 when
I keep it 78 when y'all are not here.
There it is.
I actually do. I do. Okay. I know. I was like, what the? And I was like, okay, that was right. All right. So, this is going to cause mucus to build up where? Everywhere. All right. In order to diagnose this is very important and highly testable for all of you. We do there has to be at least 2 positive sweat chloride tests. So they pick a little spot on the kid's arm and they put this like kind of heat source, this little machine thing on it that makes you sweat. And then they get a swab of the sweat and they're testing basically to see how much salt is in it, right? Because, I mean, your sweat is a little salty, but they're obviously going to lose a lot more sodium. Yes? Okay. So it is considered positive if in an infant it's greater than 40 or if in a child it's greater than 60, but you have to have 2 positive ones to diagnose this. But it is a genetic disorder, so we will follow up with genetic testing, but that takes 6 to 8 weeks and we don't really have time for that. Now, Texas did put this on the newborn screen several years ago. But remember, newborn screens, it's just a screen. So you can have false positives. You can also have false negatives. But you don't know what a newborn screen is?
Is that the heel stick?
They do a heel stick at newborn, and then they have to do another one before they're 14 days of age. Okay, and they send it off to the state, and they test it for all these different genetic diseases. And then they keep your DNA on file and sell it to companies, which there's a massive lawsuit right now because they sold all these babies' DNA and it was not theirs to sell. You do not have to do the newborn screen because there's really no way to know what they're doing with your blood after that.
Isn't there a part 2 where you can tell them to destroy it after your testing?
Yes, but the problem was they did not do that. They sold it to companies that were doing testing on DNA. So they sold your baby's DNA to God knows who, and the parents were, yeah, it is scary because that could be stored anywhere for any reason. You don't know what they're using it for, you know, so nah, that ain't it. All right, so let's talk about the signs and symptoms. We all think of it as a lung disease, right? So the mucus in the lungs, obviously very thick, very sticky mucus, okay? So they're gonna have cough. They always have crackles, so do we report crackles for CF? No, because they always have that. But with the fluid just sitting there, obviously they get frequent episodes of pneumonia, and they get weird pneumonias because they're not immunocompromised per se, but their lungs are not healthy enough to get rid of the normal things that we would get rid of, and they usually get weird bacteria. Okay. Recurrent URIs is common. What's that? Upper respiratory infections. They have dyspnea, tachypnea, all of the, like the normal stuff that you would expect. What is hypercapnia? Too much CO2 because they don't have enough oxygen. And chronic hypoxia leads to what sign and symptom? Clubbing of the fingernails. Chronic hypoxia, right? They don't just curve in front of our eyes. Yes. All right, then. Paroxysmal cough. What is that? That's the characteristic cough of CF. What's a paroxysmal cough? No. Paroxysmal? They get coughing fits. Paroxysmal is where you cough, 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 can't catch your breath, can't catch your breath. Cough, 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 cough. Okay, we sometimes see in pertussis as well. They can have a paroxysmal cough as well. Okay. All right, so how are we going to how are we going to fix our lungs? Yes, we're going to put a CPT vest on. That is chest physiotherapies. They put the vest on and it shakes them. When should you not do that? Right after they ate lunch. No, you can do it for babies, but you got to make sure you space it not around meals or what's going to happen. They're going to puke on you. Okay, so we're going to do CPT. We'll do any pulmonary toilet. They will do percussion and all of that kind of stuff to try to break up the mucus. Postural drainage, right? What kind of drugs can we give to help them break up the mucus? Expectorants, mucolytics, right? That helps to thin it. So how much fluid do you want this kid to have a day? A lot, like 3 liters at least. Yes? Okay. We're going to sit them upright. Obviously, we're going to TCDB. That's a given. Yeah? What drugs do you want to give to help the lungs? Probably not. We'll do bronchodilators. They don't need steroids, right? We're just trying to open up their airways, okay? So we'll give them bronchodilators and mucolytics. Then they created a drug for CF kids. It is called Dornase alpha or Pulmozyme. It is inhaled, and it actually breaks up the DNA in their lungs that's causing this very thick mucus. Ain't that something? I know. It's like AI weird stuff, right? So that's called Dornase alpha. Y'all with me? That's a nebulized medication that breaks up because you can try to treat the mucus as much as you want, but it's going to keep making it because this is genetic, right? Yeah, it's on. Most common bacteria we see with cystic fibrosis would be Pseudomonas. What do you know about Pseudomonas? Green, weepy, nasty, right? It's not common to see it in pneumonia. It's common to see it in wounds or in your gut, right? So the Pseudomonas in your lungs is not normal. Burkholderia capacia. Have you heard of that one? Okay. Have you heard of very many people having staph in their lungs? No. What about Hib in their lungs? Nope. E. coli in their lungs? Well, apparently some of y'all have heard of that. Doesn't happen very often. And it's not like because you eat poop or something. It usually is because they didn't wash their hands, and that's all it took. We have E. coli that lives in our lungs. That's normal, right? And then Klebsiella is the other one that we may see, which none of these really are normal in a population that doesn't have CF. Yeah?
So what exactly the 2 drugs that you for cystic fibrosis? What did you say they exactly do?
Which ones? Pulmozyme is the brand name of Dornase alpha. You nebulize it, and it breaks up the DNA in the lungs. Cool. So that way it doesn't make as much mucus. Do you understand what I'm saying? Yeah. Okay, because you can do mucolytics all you want, but your body's going to keep making thick mucus because it's a DNA disease. Yeah? Okay. All right, let's talk about the pancreas. Okay, so your whole entire pancreas is going to fill with mucus. Okay. So can they secrete insulin very well? No. So what's their blood sugar going to do? Stop it. Hyperglycemia. It is not diabetes mellitus type 2. It is cystic fibrosis induced diabetes. Cystic fibrosis induced diabetes. So they will become insulin dependent usually. Okay. Can they produce their pancreatic enzymes? Okay. So they're not making amylase, lipase, or trypsin, right? So then they can't absorb what? Fats, carbs, or proteins. So what happens to the weight in a kid with cystic fibrosis? It's going to decrease. They're going to have malnutrition. What do you think their poop's going to look like? Steatorrhea, because they cannot absorb fats, right? So it's going to be that fatty, frothy stool. What do you say? Yes, we will. We'll do pancreatic enzymes with every single meal and snacks. Remember, you open and sprinkle, right, on every single meal. They will end up getting pancreatic fibrosis because any chronic inflammation or chronic issues with any organ is going to cause fibrosis. So we need to check their blood sugar. They're probably going to be insulin dependent forever, right? Because this is a genetic disease. And then we do pancreatic enzymes with every snack and every meal. We sprinkle them on, right? All right, let's go into the gut. Their entire gut fills with mucus. That's bad because you can't digest. You can get very constipated, which can lead to Paction, which can then lead to an obstruction, which can then lead to perforation. That is common. They also have a high rate of intussusception. What's intussusception? The telescoping. What'd you say? That's a sausage one. It is a sausage-shaped mass. Yes.
Does anybody
You know, sausage! Oh my God, I would have loved it if you had said that. Now, one of the ways that we will know very early on that a kid has CF is they will not pass meconium. What is meconium? The first poop. It's very mucousy. It's like black. It's gross. Okay. They should pass that. How long do they have to pass it? 24 hours. If they do not pass meconium in 24 hours, then we would be concerned for cystic fibrosis. It could be a bunch of different diseases too, but this is just one of the differentials.
So why would they not have meconium?
Because their gut is filled with mucus, so nothing is moving, right? So the normal, like the amniotic fluid that they can't go anywhere.
So the gut's not moving, so it's still in
I mean, it's
there, just
moving,
not-
I guess. It's got to move through thick mucus now instead of just going through a sterile gut, right? All right, so can they absorb their fat-soluble vitamins? Nope. So they're going to be deficient in ADEC. They are going to have obviously massive weight loss because they're not absorbing anything. So the baby's going to appear failure to thrive, which means he's less than 5% on the growth curve. Yes? Okay. They are also at risk. We already talked about bowel perforation. We talked about bowel obstructions, and they're also at higher risk of rectal prolapse because when they are trying to push to poop, the whole rectum can come out because it's full of mucus and they're having to push very, very hard. There's a lot of pressure inside of there. That is the most terrifying thing I think I've ever seen. What kind of diet do we put this kid on? They're very malnourished, right? Well, they do need fluids, like 3 to 4 liters of fluid a day. They need high calorie. Well, we can't do high fat because their gut can't do it. So if you can't do protein, if you can't do fat, then you should probably do high protein. Yes, because that's going to help them gain weight better than carbs, right? So they need a high calorie, high protein diet. They have to take an ADEC supplement, but it has to be in water soluble format. You can't take it in fat soluble format because you can't digest fats, right? Now there's a lot of discrepancies on what you should do with their fat, okay? Some places will say put them on a high fat diet and just give them pancreatic enzymes. I've never seen a CF kid do super well with that. So just look and see what your professor wants you to pick or whatever. But high calorie, high protein, you cannot go wrong with that. Okay. The other issue that's up for debate is the salt. Okay. Now they are losing a lot of salt. Yes. But I never want to tell someone to have a high salt diet, right? So just say at least adequate salts. You know, they don't need low salt. They just need adequate salt. You need to watch their bowel movements, of course. Okay. Now, early on in the disease, they are hungry as hell because they're not absorbing anything. Later on, their body just gets to the point where they just don't feel like eating anymore. So by the time they're teenagers, they're usually very, very underweight. And they may rapidly lose weight at the beginning of the disease if we didn't diagnose it, right? Now it's actually much better. It's in the 30s and 40s. It used to be 15. So it's much better. And the reason why, too, they now are allowing cystic fibrosis patients to be a candidate for subpar lung transplants. So if the lung was not perfect, before the rule was for transplant, it doesn't matter who you're trying to give it to. If a lung is not perfect, it's just discarded. So, but then they were like, hey, we're getting rid of these like almost perfect lungs when CF patients will never qualify for a lung transplant no matter what, because the lungs are going to get ruined again, right? So they were like, well, how about we take these ones that are not matching, like they won't fit perfectly for a regular transplant. Can we transplant these CF patients? And the government, I guess, finally said yes. And so now they've been very successful with lung transplants. Right. So it gives them a whole nother 15 to 20 years, because before it was 15 years. That's how long their lungs would last. Now with the transplants, we're getting another 15 to 20 years, so they can live into their 30s and 40s, which is a really beautiful thing. Most of the adolescents will end up needing a G-tube because they never feel hungry and their stomach hurts when they eat anyway. And you got to watch out with the teens. Now, most hospitals will have a teen unit, but you can't hang out with other cystic fibrosis kids for long periods of time because you're going to get the same bacteria and pneumonia that they get. CF kids with pneumonia are supposed to be separated, so they don't keep giving each other bacteria. But they do, like at Texas Children's, they have sibling rooms since this is genetic. So that way mom can stay with both of the kids at the same time in the same room. It's a giant room, like the size of this. And there's one kid over here and one kid over there, because if they both have pneumonia at the same time, chances are it's the same pneumonia, right? But when I was there working on 14, that's the CF floor, they have like a group of girls that would all hang out together, right? The cystic fibrosis little girls, and they all made a pact. We did not know this, okay, but they were all losing like massive amounts of weight, and we were like, why? This is the first time we've had all these teenage girls needing a G tube like rapidly in succession. They had made a pact, and they said whoever can lose the most weight and get a G tube first wins their little pact. Ma'am. So it's just, it's tough because having CF is tough anyway, right? You're out of school a lot, and then you're not really supposed to hang out with other CF kids, but those are the only people that really understand you. You know what I mean? So anyways, they may end up needing a G tube just because they can't maintain the weight and they can't get enough NPO. With those kids, we can put them on continuous feeds at nighttime, and so they don't even have to bother with it during the day. They can eat by mouth during the day, and then we just put them on a certain cc's of formula at nighttime and hook them up with their G tube, and that's actually a pretty nice setup. Okay. All right, then the mucus is also going to fill the liver, okay, causing portal hypertension, biliary fibrosis. What's that? Their liver's going to get fibrotic because it's chronically filled with mucus, yes, and they're going to have massive malabsorption, okay. It also fills the entire reproductive tract. So the girls can still get pregnant. It just makes it much more difficult because your cervical mucus has to be like exactly a certain consistency in order for sperm to be able to travel. Since this is high mucus, it makes it a lot harder for them to get pregnant. They can get pregnant, but they will be considered a high-risk pregnancy. For males, the mucus fills the testicles, and so the males with CF are sterile. What's not?
I just the thought of like that coming out as like ejaculation.
Oh, it doesn't. Sorry, it doesn't do that.
I was thinking like kiss slide. Sorry.
Again, that was Lexi. Okay. It's not like that. That's not how any of this works. Okay. But because it does change the consistency and it can sometimes prevent it from. Yeah. I guess we're just gonna have a Nickelodeon slime day. Okay. All right. Do we have questions on cystic fibrosis? I will never get that image out of my mind.
Sorry.